Sciatica, a common condition that affects many, has actually lesser known symptoms. That's why in this video, I will teach you 4 symptoms that you should never ignore if you have been diagnosed with sciatic nerve pain or if you feel numbness in your lower leg. Stay with me until the end because I will also teach you what to do if ever, God forbids, you are faced in this situation. Hi, this is again Doc Sherry, Doctor of Physical Therapy, teaching you practical health tips and home exercise programs that you can surely benefit from. Sciatica, which is a mysterious condition for some, is actually the compression of the biggest nerve in your body, which is the sciatic nerve. Maybe you can already relate to the symptoms where you feel nagging pain in your back that goes down to your lower leg. But here's a twist in the symptoms. Imagine going out on your day-to-day activities when suddenly you feel loss of control in your ability to pee or your ability to remove waste from your body. Your legs become too weak that it is hard for you to stand or walk. You feel severe onset of pain and you experience worsening of your symptoms. These will tell you that you should not take this lightly. Clinical studies and patient experience have shown that these are red flags for as much as sciatic nerve pain is concerned, whether it is due to osteoarthritis of the spine or due to disc herniation. Never ignore these 4 symptoms. Loss of bowel and bladder control. This will tell you that there is severe nerve compression in the sciatic nerve. The most pressing concern for loss of bowel and bladder control is what we call as SCAquina Syndrome. Although rare, it is actually severe, to the point that if it is not addressed immediately, this can become a permanent disability. With SCAquina Syndrome, there is actually severe compression and damage to the bundles of nerves that are located in the end of your spinal cord. Patients are unable to control urination and even the removal of waste from the body. If left untreated, it will also lead to total loss of function in your lower leg and even loss of sensation and absence of reflex. Imagine the inconvenience it can give to the patient and to the family members if one loses the control in urination and the removal of waste in the body. Plus, it can also predispose one to frequent infections like UTI and even severe health problems. If you're battling with sciatica symptoms, never take for granted loss of bowel and bladder control. It is very important. Leg weakness. This will tell you that sciatica is actually worsening. This is relatively common and I have read it many times in the comment section with our previous videos. If you find that your legs are too weak, that you are unable to support your body weight, if you find it hard to walk and even stand, consider it as a red flag sign and you need to have yourself checked immediately. Now, the muscles that are affected is actually based on the level of compression in the sciatic nerve. So, for example, if the compression of the sciatic nerve is located in your lower lumbar spine, you can expect weakness in your calf muscles. However, if the compression of the sciatic nerve is at the higher level of the lumbar spine, you can expect weakness in your groin and in even your thigh muscles. These will make movement difficult, like walking, standing, and going up the stairs. You should never take this lightly. Before we proceed with the other 2 symptoms that you should never take for granted if you have sciatic nerve pain, at this point, I would like to ask a tiny favor from you to please click the like button below if this video or any videos in our channel have been helpful to you. Also, if you haven't subscribed yet, please click the subscribe button below so you won't miss out in our future videos. Worsening pain. Look at this visual analog scale. This is a gauge for you to determine the intensity of the pain. ranging from 0 to 10, with 0 being no pain and 10 being severe. Try to gauge your pain and then try to gauge afterwards if your pain have increased. This will tell you that it is a red flag sign for sciatica, and it will tell you to have yourself checked immediately because this may mean other underlying symptom. Two possible reasons for this is increased inflammation in the structure surrounding the sciatic nerve, either due to injury or trauma or even to body's autoimmune response. This can also mean worsening of disc herniation if the cause of your sciatic nerve pain is due to a herniated disc. You see, with disc herniation, we have specific staging, 4 stages for that. And that's why even on the latter part, which is sequestered disc, usually surgery is warranted or needed. If you want to know more about specific stages, symptoms, and even the correct treatment for disc herniation, we have a separate video for that here, which you can get back on later when you end this video. Lastly, if you experience sudden onset of severe symptoms without any history of trauma or accident, please don't hesitate and please check with your doctor immediately because these may actually mean other underlying symptoms. Severe and sudden onset of pain can actually cause debilitating and excruciating pain, which can affect your ability to move and affect your quality of life. If you experience sudden loss of control in your bowel and bladder movement, if you find that your legs are too weak that you are unable to walk and to stand, if you experience worsening of your pain, and you experience severe and sudden onset of symptoms in the absence of trauma or injury, please have yourself checked immediately because time is your most valuable resource here. If not properly addressed, these can lead to irreversible and permanent disability. If you want to know about the proper exercises for sciatica based on your X-ray and your MRI result, we have a video here. You can check on it later. Or if you want to know about the seeds that you can incorporate in your diet to help lessen symptoms of sciatica, we also have a video here. This will be helpful for you. If you have reached the end of this video, please comment spine in the comment section below. Should you have any questions about this video, please comment down below because I would really try my best to get back on you. Thank you very much for watching. I hope that this video is able to guide and help you. This is again Doc Sherry. Stay safe, stay happy and healthy. God bless you.